And we're live.
Great. Thank you all for being here. This is the session called Measuring 2Gen, Building a Framework. So my name is Stephanie Fritz, and I'm the Senior Director of Strategic Research and Analytics for United Way of Central Indiana. I'm joined with my colleague from Polis, Rebecca Nannery, and I'll let her introduce herself.
Hi, my name is Rebecca Nannery, and I'm a Senior Research Analyst at the Polis Center at uwci.
Great. This session will focus on Great Families 2020 program, which was a 4-year initiative of United Way of Central Indiana that used the 2Gen approach to improve the lives of Central Indiana families in 5 Indianapolis neighborhoods. We'll be discussing the Great Families 2020 program, evaluation and outcomes, and how United Way incorporated the learnings from Great Families 2020 into its current 2Gen framework. Of course, this work would not be completed without great partners. In 2016, United Way of Central Indiana was awarded $7 million of a federal matching grant from the Social Innovation Fund with AmeriCorps to develop a plan to address family instability by using promising practices with the 2-generation approach. We partnered with IUPUI, IUPUI's Public Policy Institute, and the Polis Center to serve as third-party evaluators for this project. So through our Social Innovation Fund grant, United Way has developed a 2Gen program model developed by the Ascend Institute. The goal of this program was to provide financial stability among families in Central Indiana. The program targeted service delivery to the whole family, specifically one custodial parent or caregiver and at least one child between the ages of 0 and 6, living together as a family and in need of economic support or stabilization services. Brief background on this program. So as I mentioned, in 2016, we received the grant from the Social Innovation Fund to develop and implement Great Families 2020. And through this grant, families were engaged that were engaged in Great Families 2020 would receive targeted services specific to their goals and needs in the following areas that you can see here on the right with these cogs: social capital, early childhood education, post-secondary and employment pathways, economic assets, health and well-being. The cogs on the right provide a specific example of these services received in each of these areas. So under social capital, we would convene families and peers in networks, in parent cafes, develop specific cohort strategies. Under health and well-being, there were referrals made for mental, physical, behavioral access. There was financial counseling underneath economic assets with a focus on accessing housing and public supports, improving their financial capacity and understanding, accessing transportation. Within post-secondary and employment pathways, access to educational outcomes, trainings and certification programs, workforce partnerships and job placements. And early childhood education is focusing on access to high quality early childhood education services. The program specifically focused on improving multiple outcomes for engaged families that included socio and emotional development and kindergarten readiness for children, the financial and employment related outcomes for parents, and social capital, community engagement, and improving protective factors. So protective factors of youth and the family, and improving health related outcomes for the parents that benefited from the program, and also that benefited the entire family unit. At the end of the 4 years, 734 families were served by Great Families 2020. That included 789 parents and caregivers and 1,211 children. To accomplish these goals, Great Families 2020 was highly collaborative. 8 community partners served as subgrantees to implement the Great Families 2020 integrated program model that focused on 5 specific neighborhoods. It was their hard work that led to the success of this program. On the right-hand side, we listed these subgrantees and our partners. So on the Far East Side, we had the Community Alliance of the Far East Side Cafe. On the Near East Side, the John Bonner Neighborhood Center, East 10th Street United Methodist Church Children and Youth Center, Englewood Christian Church. On the Near West Side, we had a partnership with Hawthorne Community Center and the Marion County Commission on Youth, McCoy. And the Northeast Side, we had the Edna Martin Christian Center. And the Northwest Side, we had the Martin Luther King Community Center. Through their work, these subgrantees partnered with approximately 77 other community-based organizations that included early childhood education centers, the Center for Working Families, and various mental health agencies, as well as other resources that were related to the families they were serving. United Way also convened these subgrantees together for monthly peer learnings. So these peer learnings allowed for an increased understanding and knowledge of partner organizations and services and programs. So they would learn more about each other and how they operate. They would be able to share resources and information sharing on lessons learned as they were implementing their 2Gen programs. They would have increased capacity by leveraging these partnerships to potentially serve more families and establish stronger partnerships with other organizations they were working with. So at this point, I'm going to hand this over to Rebecca so that way she can speak about the evaluation background for this program.
Thank you, Stephanie. I'm going to be discussing the results of the exploratory outcomes evaluation today, but I wanted to talk briefly about 2 previous evaluation studies conducted by the evaluation team over the course of the grant period. The first of these was a feasibility study released in 2018. This was a combined implementation study and feasibility study. The implementation study aimed to understand how Great Families 2020 was implemented and the extent to which it was operating as designed. This found that the Great Families 2020 program model was largely being implemented with fidelity across core components of the model. The feasibility study assessed the extent to which a more rigorous impact evaluation planned as a matching comparison group design would be possible within the span of the grant period. We will discuss this again later as a part of the exploratory outcomes evaluation results. The second report, completed by the evaluation team in 2019, was an implementation report. Excuse me. The purpose of this implementation evaluation was to assess whether Great Families 2020 program activities were implemented as designed, to understand facilitators and barriers to the implementation of program activities, and determine gaps in services and how they impact Great Families 2020 participants who are setting and achieving goals. The findings include that the program was still being implemented with fidelity across all sites, with some site-specific variations, and that the capacity of the subgrantees improved over time. The evaluation, the exploratory outcomes evaluation completed at the end of the study, from which I will be discussing some of the results today, was classified by the Centers for National and Community Service, now known as AmeriCorps, as providing a preliminary level of evidence about the effectiveness of Great Families 2020's 2Gen approach. This evaluation answered a few research questions. To what extent do Great Families 2020 participants differ from Center for Working Families participants on short-term outcomes? To what extent do Great Families participant outcomes change from baseline to follow-up? Which Great Families program components are associated with parent outcomes? To what extent do participant outcomes vary by site? What lessons and takeaways have grantees and subgrantees learned about 2Gen programming? And what perspectives can Great Families provide for the United Way's ongoing local programming? The exploratory evaluation took a mixed methods approach to analyzing outcomes and providing context around these. Part of the evaluation team at the Indiana University Public Policy Institute conducted interviews and focus groups of program staff and participants at two different points, during the program and at the end of it. It also conducted two surveys about subgrantee collaboration and partnerships to understand how these changed over time. An online participant satisfaction survey in 2020 asked about the effectiveness of Great Families services and what was most meaningful about these to them. And finally, a document review was completed to learn about subgrantee COVID-19 planning and sustainability. The other part of the evaluation team at the Polis Center at IUPUI conducted the quantitative analysis of the administrative and program data that the Great Families 2020 program staff entered into the efforts to outcomes for ETO software. Stephanie will now speak briefly about why ETO was chosen and its administration by United Way.
Yeah, so Efforts to Outcomes is an online human services data tracking software that's operated by Social Solutions. It's unique in the sense that it allows for it was specifically designed to track incremental progress for clients served in the human services sector. So ETO additionally allows for families to be connected together with a unique identifier, which was critical in allowing us to look at outcomes for youth and outcomes for adults and knit them together as a cohesive family unit to be able to see how the family as a whole is improving. So in addition to this, United Way has been offering access to ETO along to any nonprofit in Central Indiana at a subsidized cost and along with that comes a team of research associates who are certified in the software that provides guidance on data collections, outcomes reporting, and report writing and outcome analysis. So because of that work, all of the subgrantees were already on the ETO platform. So, and additionally, they were on it through either our work just in supporting them of use and access to ETO or through their work with the Center for Working Families, because that is the primary data collection tool for the Center for Working Families. So it was a logical step to utilize this tool due to the software's security when it comes to data collection, its analytical ability to collect and track data at an individual level and a family level, and then also with the added benefit of having familiarity across all the SAMP grantees at the time. That is why the tool was chosen to collect program data for Great Families 2020.
Thank you, Stephanie. I'm now going to discuss the ETO data about program demographics and participant program data, and also neighborhood demographics. And these data originate from the U.S. Census's American Community Survey. A majority of the parent or caregiver participants in the program were between the ages of 25 to 35, which makes sense as that's the age when folks most commonly have children. The share of Black and Hispanic and Latinx participants was higher in the program than of the demographics in the neighborhood. Child participants mirror the gender distribution of the neighborhood, while a greater proportion of parent or caregiver participants are women, 90% in fact. Households in the Great Families 2020 neighborhoods tended to have lower incomes than in the county overall. So median of $12,000 per year. While Great Families program participants had incomes that are a fraction of the neighborhood median. Participant education levels were similar to the neighborhood residents overall. The majority, or the most, about over a third of folks in the neighborhood had a high school diploma. a fifth had no diploma. And compared to the neighborhoods, a higher share of program participants were in the workforce and seeking employment. While the program was in operation between October 2017 and June 2020, Great Families participated in programming designed to correspond to the 5 key components or domains of the 2-gen model. Participation metrics for each component include, for the high quality early childhood education, 781 children attended early childhood education. 138 education and work-related goals were completed. 147 financial goals were completed. 71 mental and physical health goals were completed. And 281 social capital events for families in the program were held. The family coaching process of the Great Families model involved developing a relationship with a family coach to set and maintain goals in the 5 areas of the 2-gen model using a family success plan and to connect families to services in those 5 areas that are provided by participant partner agencies and within the subgrantees organizations themselves. 86% of parents or caregivers participated in coaching session. 679 parents or caregivers attended an average of about 9 family coaching meetings while they were in the program. Almost half of parents and caregivers received a warm referral, which I'll talk more about that later. In all, 361 parents or caregivers received over 1,200 referrals. And the most common referral category was related to community and family, and 43% referrals were in this category. In all the sites, participants most often set financial and education and work-related goals. And the ones that were completed most often were related to parenting and the child's education. Also called warm handoffs. A warm referral is the process where a coach meaningfully guides a family to a service provider or another agency after making a referral, instead of having the program participant make the arrangements themselves. Across all the sites, the participants were most often referred to community and family services, and food and nutrition had the highest attendance rate of all the referral types. I'll now be discussing the quantitative analysis that we did to address the research questions that I mentioned earlier. The outcomes analysis mostly relied on data from the ETO software. I'll talk about what each of those questions intended to tell us and what it means for practice. I will also talk about the specific indicators that were chosen, what the data collection and/or analysis process looked like, and any limitations we experienced on the way, and the results and what they mean. The first set of research questions that I'm going to discuss ask whether program outcomes related to the 5 2-gen areas exhibited significant change over a participant's duration in the program. The first domain outcome that we are going to discuss is the change in early childhood education experienced by children enrolled in the program. This indicator measured child gains in kindergarten readiness using the Indiana Department of Education standardized tool, the iStar-KR, which assessed child progress in functional areas related to hygiene and socio-emotional progress in math and English, language arts. Children in the program were to be administered the iStar-KR annually by their early childhood education teachers so that we could analyze whether they showed improvements in the tested areas over time. The children's names were sent to the Indiana Department of Education, which would then conduct a name-based match and provide the I-STAR KR scores for analysis. This matching system was the result of the creation of a data sharing agreement around this personally identifiable information, and that agreement was between IUPUI, uwci, and the DOE. Unfortunately, the first set of test scores requested in 2019 only returned 22 out of the 335 requested matches. And that was too small of a sample size to conduct basic statistical analysis. Discussions ensued about alternative approaches in order to increase the match rate, but these turned out to be infeasible. Even if the match rate could have been improved, state-level policy changes in 2019 resulted in a discontinuation in the use of the I-STAR KR with the introduction of the DOE's new iSprout performance test. Around the same time, the state also introduced mandated kindergarten readiness indicators to be implemented by the Family and Social Services Administration across On My Way pre-K providers, which the early childhood education providers were. Its implementation was hampered by the COVID-19 pandemic and insufficient access to technology in the classroom. It was also not reported at the individual level. So while the lack of data and thus results is disappointing, the preliminary data indicated that there is promise for using these indicators in the future to measure child-related 2-gen outcomes. Another 2-gen domain measured adult outcomes related to post-secondary education and employment goals. These included indicators such as obtaining an education credential, obtaining employment or better paying employment, and job retention among parents and caregivers participating in great families. While coaches recorded information related to these, the data sets provided for analysis either had too few observations to conduct a quantitative analysis or had very few or no data pairs that could be used to assess a change over time. As a stopgap measure, we analyzed Family Success Plan survey data administered to participants by the coaches pertaining to employment and job satisfaction measures among program participants. However, these analyses did not result in statistically significant results, related in part to insufficient data, as participants only answered these questions if they had a job. The third 2-gen domain we measured was economic assets. We defined this as a participant's monthly income, which was collected from the complete financial assessment that the participants completed periodically at the Centers for Working Families. We had hoped to test other indicators such as credit score or savings, but these had higher rates of missing data. We did significance testing to determine if the last complete financial assessment that the participant did was significantly different than the first one that they completed. Because many of the participants didn't have 2 assessments completed or were missing the income indicator, we were only able to analyze the income change of 137 participants. The graph pictured here represents the measurements of the baseline measurement, so the first financial assessment completed, the last measurement completed, and the difference between them on the right. We typically discuss income as a median or the middle value, and the median baseline income was $1,400 per month, while the follow-up was $1,700 per month. The median difference between these was 0, in part because 1/3 of participants did not experience a change in income. The average difference, however, was $223. When we do significance testing of data, 3 things we should pay attention to include: was the change statistically significant? Was an increase or a decrease? And what is the size of that change? A significance test between the baseline and last measurement indicated that there was a statistically significant increase in monthly income among Great Families 2020 participants. A test to determine the size of the change revealed that this change was small. This means that the difference is not big enough to be obvious at a glance and requires a more in-depth look to determine that the change is indeed there. A large effect size would be obvious, like the difference between the wages of people with a high school degree and people with a master's degree. The fourth 2-gem domain that we measured was health and well-being. This was to be measured by adult participants completing a family success plan survey when they first entered the program, and then every 6 months after that. The survey asked a variety of questions about different topics. Questions about a similar topic were grouped together to create a single indicator. For instance, 6 different questions about the participants' physical and mental health were combined to create a single physical and mental health indicator score. Participants were also asked questions which were combined to create indicators related to factors contributing to their well-being, including their relationship with their child, their understanding of child development and parenting, how well their families work together to solve problems, the presence of people in their lives to support them, and whether they knew where to go if they needed help or support of some kind. Of these protective factors, child development, family functioning and resiliency, and concrete supports had statistically significant changes, which we will discuss in a minute. We conducted 3 sets of significance testing for each indicator listed on the slide. One test for the difference between the baseline measurement and the first follow-up measurement, one for the difference between the baseline and second follow-up measurements, and one for the difference between the baseline and the third follow-up measurement. This allowed us to observe whether more time in the program yielded superior results. Some of the challenges we ran into during analysis was that a little more than half of adult participants in the program completed more than one family success plan survey, and that number decreased among those who completed multiple surveys. This may have resulted in the difference between the baseline and third follow-up surveys not being significant for some indicators, which might have been different if there were additional or more participants included in the analysis. And we will now discuss the health results. So this slide depicts the results of 4 iterations of the physical and mental health indicator as an average participant score based on a 5-point scale. The N refers to the number of participants who completed the survey questions and grows smaller the longer a family is in the program. Analysis revealed that there was a statistically significant increase for all 3 time periods studied. However, the size of difference between the baseline and first follow-up is negligible. On the other hand, the size of the difference between the baseline measurement and the second and third follow-up measurements was small, similar in meaning to that of the difference in monthly income size. What this tells us is that participants experience a small but measurable increase in their reported physical and mental health after being in the program for at least 1 year. The indicator testing a parent's understanding of their child's development and their own parenting has a similar interpretation as a physical and mental health indicator. Participants experience a small but measurable increase in their reported understanding of child development and parenting after being in the program at least 1 year. The results were a little different for the indicator that measures how well a family works together during difficult times. The only statistically significant change was for participants who had been in the program for 1 year. This was a small but measurable improvement. It's possible that at the first follow-up there was not enough time in the program to see a difference, and that there may not have been enough participants taking a third follow-up survey for us to be able to see a statistically significant measurable change. Finally, participants reported knowledge about where to find support or knowing what to do when they needed it, improved across all 3 time periods, from 6 months into the program to a year and a half into the program. The size of this change was small but measurable for all 3. The final 2-gen area for which we measured whether there was a change over the course of program participation is social capital. We used 2 different indicators, each composed of 4 or 5 separate questions. The civic engagement indicator relates to whether participants attend formal events or meetings in public settings, or socialize with friends or family in private ones. The social networks indicator relates to participant attitudes about the community around them. These indicators were also measured using the Family Success Plan survey, and thus had the same process and challenges as for the health and well-being indicators that I just discussed. The results of the social networks measure are interpreted in the same way as the health and well-being results. Participants reported a statistically significant improvement in how they felt about the community around them at 6 months, a year, and a year and a half after starting the program. This change was small in size. However, despite statistically significant improvements in actual participant engagement in their communities at both the 6-month and 1-year marks of the program, these changes were too small to be meaningful. In sum, Great Families 2020 participants experienced changes across the 3 2-gen domains for which we were able to analyze data: economic assets, health and well-being, and social capital. Another research question that we answered as a part of the evaluation process is what aspects of the Great Families 2020 program were significantly related to program outcomes. We looked at these program components in relation to the change during program involvement for the monthly income and the Family Success Plan survey indicators I just discussed. It's important to understand what parts of the program matter to achieve particular results. This can let us know what types of activity or actions to focus on to achieve particular participant outcomes, or which we may need to adjust or improve. The analysis for this research question took into consideration a variety of participant and other characteristics so that we could demonstrate whether there was anything about the participants or the sites themselves that influenced the results. This was largely not the case. The program components that we tested included the average length of a participant's coaching sessions in minutes. We tested setting or achieving at least 1 goal and receiving or attending at least 1 referral. We also looked at the number of centers for working families services that participants engaged in: none, or 1, 2, or all of employment counseling, financial counseling, or income supports. We took into account whether there was at least 1 child with early childhood education attendance data. We included the number of social capital events the participant attended. We took into account some other indicators, including the personal characteristics of the program participants, such as gender, race, ethnicity, employment, education, and housing. We also included the length of time in the program and the site or neighborhood where the family was engaged in the program. Our results revealed that 2 program components matter for the outcomes as measured for this evaluation. These were the average length of participant coaching sessions and whether or not the participant was given or attended a warm referral. We found that there were increases in 4 different outcome variables that were significantly related to the average length of participant coaching sessions. Longer Great Families coaching sessions were related to larger increases in monthly income, accounting for 9% of the total change in a participant's monthly income. While the length of the coaching session did not account for as large of a change in the remainder of the outcomes, Longer sessions did result in larger increases related to how much participants interacted with the community around them, how much they knew about their child's development and how to parent well, and whether they have emotional support from those around them. The significant results related to referrals was more of a mixed bag than for coaching. A positive change in a participant's knowledge about where to find resources or support when they need it is associated with having received at least one warm referral. This makes sense because knowing where to go for help to address an immediate concern increases that person's knowledge about addressing the same or similar concerns in the future. An increase in participant knowledge about child development and parenting was positively associated with attending a referral, which certainly makes sense in light of the types of referrals available to families as a part of their Great Families 2020 experience. However, attending a referral was associated with decreases in both engagement in the community and in social support systems. It is possible that addressing participant needs through referral-based services also diminished other types of community engagement or reliance on others around them. Unfortunately, the data does not explain why this phenomenon takes place. The next research question that we are going to discuss is whether the site or neighborhood where participants engaged in Great Families impacted their program outcomes. Analysis found that individual participant outcomes do not differ by the site where they access Great Families 2020. However, specific site characteristics did play a role in participant outcomes. Namely, sites that indicated through surveys that they have higher levels of collaboration with other organizations were associated with more participant gains in their connection with their children and in their social support systems. However, higher collaboration was associated with fewer participant gains in their understanding of child development and their parenting skills. When differences in program characteristics by site were tested, it was found that longer coaching interactions were associated with increases in parent connection with their children and their monthly income. Higher numbers of completed goals were associated with improvement in knowledge of child development and parenting skills. This indicates that site-level activities and decisions may impact their respective participant outcomes and experiences differently. The final research question that we are going to discuss today is whether families who participated in Great Families 2020, including the Center for Working Families programming, had different outcomes than families who received services at the Centers for Working Families, but did not receive services specific to the Great Families 2020 program. While the plan was originally to also administer the Family Success Plan surveys to the families who received only Center for Working Families services, this piece of the study became infeasible. So we instead decided to simply test whether there was a difference in incomes between these two groups as collected from their complete financial assessments at the Centers for Working Families. We found that there was not a significant difference in monthly income between these two groups. This is probably influenced by the number of participants included in the analysis. It is possible that a larger number of Great Families participants might have yielded significant results. I am now going to discuss some of the challenges and limitations impacting the analysis of ETO data that we faced during the analysis. One challenge that we encountered was a trade-off between the rigor and fit of the measures we used. AmeriCorps, then known as the Centers for Community and National Service, emphasized the use of validated surveys to collect outcome data from program participants. What this means is we had to use surveys developed by someone else that were tested over and over to make sure that the outcomes measured were consistent based on the questions being asked. However, it is possible that some of these survey questions and associated measures weren't the best fit for the Great Families 2020 programming, such as the different types of social capital related programming and events that participants engaged in. As a result, the impact of these programs may not have been adequately measured, perhaps obscuring the true results of those activities. Second, data quality issues impacted the data used for the analysis. Much of this was in the form of data missing from ETO. The implementation study revealed that staff turnover and hiring delays hampered the ability of new staff to be trained, use ETO, and thus enter participant data into it. Reliance on program staff to enter data in addition to providing coaching and other services resulted in addressing participant needs being a higher priority than data entry, and rightly so. This underscores the importance of designating data entry specialists as a part of the program. Additionally, some indicators were more challenging to collect than others. For instance, collecting attendance data at social capital events was difficult if staff were busy with running the event, and HIPAA requirements may prohibit coaches from learning if participants attended a health-related referral. Finally, the COVID-19 pandemic impacted the final months of the program, including by canceling events for early childhood education and making it more difficult to coach parents. Additionally, some Great Family staff members experienced poor internet access, which impacted their ability to enter ETO data or perform other program tasks that required internet access. Thank you for listening to me discuss the results of the program evaluation. I'm now going to turn it over to Stephanie to finish off the presentation.
Thank you, Rebecca. PPI and Pulse have been really valuable partners in this Great Families 2020 program, and we just really appreciated all of the rigor and just evaluative skills that you've brought to this program. So the takeaways from this are that the Great Families 2020 has shown that it's an innovative way for local community organizations to partner together to provide these wraparound services for underserved families. United Way took a lot of lessons learned from this pilot and incorporated them into our current and ongoing 2GEN work. And this is our need. It's greater than ever. So in 2019, after our initial implementation study results, United Way began planning on how to take these lessons learned and move them into a model that would continue to support these families. So looking at United Way's ALICE data, which stands for Asset Limited, Income Constrained, and Employed, there are approximately 216,000 families in central Indiana that are living, that are close or are in poverty. That's about 38% of households in our 7-county service area that are living below the ALICE threshold. And we know that number is growing. So United Way knew that we had to continue to work to serve families and continue to invest in this 2GEN work. So we developed the Family Opportunity Fund. The Family Opportunity Fund aims to interrupt the cycle of poverty by serving the entire family's need in those same focus areas of educational success, workforce development and economic assets, social capital, and health and well-being. As we've stated throughout this, as you've seen through this entire presentation, the Social Innovation Fund grant required us to conduct very rigorous evaluation for Great Families 2020. To that end, you see that Great Families 2020 was very standardized. It was structured in the metrics we had to use and the data that we had to collect. So in the development of our new framework, we acknowledge that 2GEN may and should look just as unique to whatever organization is implementing that 2GEN program. So to that end, we knew that we could not just develop a limited set of metrics to measure the success of organizations operating a 2GEN program. So we partnered with a consulting agency here in Central Indiana called KSMC Consulting to help us develop metrics that would allow us to broadly measure long-term outcomes and focus on longitudinal outcomes, so tracking success of families over time rather than immediate outputs. We conducted large number of focus groups to develop metrics to that our impact fund recipients must report to. Again, in the areas of workforce education, social capital, and health and well-being. So these focus groups incorporated internal United Way staff, our funded Great Families 2020 partners, subject matter experts in the areas of all the domains, and also additional CBOs doing the work, that are working in the space to ensure that the metrics we identified, again, that was appropriate for the work that we were wanting to measure. We also acknowledged that we had to develop new partnerships. So many CBOs may not have access, or organizations may not have access to partnerships and the long-term data that allowed them to address long-term outcome impact of the clients that they're serving. United Way developed two key partnerships, as I mentioned before, with KSMC Consulting. That helped us develop our impact metrics. It helped us build an end-to-end impact reporting solution that would allow us to collect data easily from our funded organizations, and then collect that and analyze that and assess those long-term outcomes for those families, and then also provides long-term support and consulting in this space. Additionally, we've developed a partnership with the Management Performance Hub. The Management Performance Hub is the data collection hub for the Indiana state government, and it allows us to develop a mechanism that allows us to link clients in a de-identified manner from family opportunity organizations and our own social innovation fund organizations, and connect that de-identified data with long-term state outcomes, specifically in education and workforce and higher education, allowing United Way to make a longitudinal impact analysis to track outcomes over a long period of time, of clients and families in Central Indiana receiving 2Gen services. Finally, United Way acknowledged that they had to continue to build capacity. One of the largest success stories of the Great Families 2020 program has been the continuation of peer learnings. Family Opportunity has maintained its monthly peer learnings for organizations, funded by our Family Opportunity and Social Innovation Fund organizations. These peer learnings allow for that connections between organizations to allow them to share resources, effectively allowing them to improve each other's policies, share best practices, providing training, and just sharing knowledge in order to enhance and improve the 2Gen network within Central Indiana. So at this time, any resources that we have discussed today, the full report, the findings, and any other resources that we will provide around the Great Families 2020 initiative can be found on our new website, greatfamilies2020.com. All resources are available there, as well as some great stories of families and videos of families and some of the organizations implementing this 2Gen work. Thank you so much for attending today. So at this point, we will open it up to any questions.
So it looks like one of the first questions in the chat is, I'm not sure if you know, but if you do, but it's, what is the cost of ETO?
Yes, so we do offer a discounted rate to access ETO rather than if you were to engage with ETO individually. There is the cost for that. I put my link in the chat. You can email research@uwci.org to get that. So it's depending on the organization. We do have this only available to nonprofits. So if you email research@uwci, I'd be happy to speak with you.
And it looks like the other question that is in the chat, I'll go ahead and post it on screen, just in case those that don't have access to the chat. And it looks like you did respond in the chat as well. So I'll give a moment and then I will post that as well.
Yeah, so the other question was asking if United Way offers another partners with another organization for our ETO data initiatives. We do not. So the team that I'm on is strategic information, and we are fortunate that a part of this initiative, we have a team of 4 certified research associates who provide support, build out expertise, data collection expertise, report writing when it comes to ETO. And we are a team that is passionate about data collection and providing these services to nonprofits in Central Indiana. And we are all certified in the Efforts to Outcomes software.
And then it just looks like a few thank yous. Naima says, thank you very much. Very informed session.
Okay. Well, thank you all very much for attending today. If there are other questions, please feel free to put them in the chat.
All right, I'm going to end the broadcast.